Hello, everyone, and welcome to our question lab. We're happy to have you here once again tonight as we discuss MSK. And leading us, and very appropriately so for this topic, is Dr. Paras Vakaria, and he's going to introduce himself to us now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident currently. I originally graduated from a pharmacy school in Missouri and then went back home to Michigan to do medical school. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
I mentioned RX Coach earlier. That is our coaching program where we work one-on-one with students just like you to help you plan, prepare, and execute to maximize your potential in medical school and on your board exams. So we'll talk more about that later, but what you should know for now is that the methodology we will employ as we do these 4 question dissections will be very similar to what we do in RX Coach. So without any further ado, let's go ahead and move on and get into our first question of the evening. As you can see, the answer choices have been removed. That is by design. We do that so that these answer choices don't guide or dictate your thought process, so that you don't see an answer choice that you are unfamiliar with, which may cause you to panic while you're trying to answer the question. So I've gone ahead and removed those. And then we begin by reading the lead-in. The lead-in is the last sentence of the question itself. And the reason we do that is because we want you to know what the test writer is asking. That allows you to pick up on all the relevant clues and prevents you from having to reread that question on test day. So let's do that lead-in now. Dysregulation of which of the following genes is characteristic of the most likely diagnosis in this patient? Dysregulation of which of the following genes is characteristic of the most likely diagnosis in this patient? I'll give all of a few seconds to respond in the question box and let us know how many steps you believe this question will require. An example of a 1-step question could be where you ask for the diagnosis. An example of a 2-step question could be where you ask for the treatment of a diagnosis. And an example of a 3-step question is when you're asked for the mechanism of action for a treatment for a diagnosis. So I'll give all of you a few moments to respond in the question box and let us know how many steps you believe this question will require. You can also ask questions in the question box, and our panelists will do their very best to try to answer those questions for you. All right, I see the responses coming in. Let's go ahead and take a look at that vignette. A female neonate is examined at birth in the hospital. She was born without complications. Her mother received appropriate prenatal care. Physical examination of the child discloses fusion of the 3rd and 4th digits of the hands bilaterally, but is otherwise normal. Dysregulation of which of the following genes is characteristic of the most likely diagnosis in this patient? I want all of you to start thinking about the relevant clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off, we're told about the demographics. This is a female neonate, okay, a newborn. And a lot of times when we're given those questions and those vignettes, the first thing we're going to get is demographics. And it's always important to make note of that, as you did in this question, because automatically that's going to tell you what way you should be thinking. What are the things that you should be thinking about based on those demographics, okay? Now in this question, they also told us about specific physical exam findings that are concerning, right? Fusion of those digits of the hands bilaterally, okay? Now, as you can see, as we read initially, as Sean had read that lead-in initially, we knew this was asking about a gene question, okay? So automatically, now we're starting to see how things are clicking when we get that vignette. We know by looking at the lead-in, which is asking us specifically, dysregulation of which gene is characteristic of the most likely diagnosis. So I think we've got a few steps here to figure out. I think 1, we've got to figure out maybe what is the diagnosis here. And then 2, what gene is dysregulated in that diagnosis. So I think we've got a nice 2-step question here. So what we're going to do, we're going to go ahead and take a look at the answer choices. And what we see here are 5 answer choices. And we're going to start at the bottom and we're going to work our way up to the top. And we recommend that students do this, that they work their way, start at the bottom and work their way up to the top. And the reason is, we'll see students who they'll start at the top, they'll see something they like, and they'll select it without having gone through all the answer choices. And sometimes, as a result, they'll get that question wrong. So we recommend doing it this way so you don't make that mistake and so you don't bias yourselves. So let's go ahead and do that now. Answer choice E, WNT7, D, SRY, C, SHH, B, HOX, A, FGF1. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Boris. The poll is open. We'll wait until about 2/3 of you have responded. Remember that all of your submissions are completely anonymous. There is no penalty for guessing on test day. So you should never leave a question blank, and certainly there is no penalty tonight. So if you're unsure, don't worry, take your best guess. And as always, Boris will give us an explanation about all the wrong answers and all the right answers. All right, I see the responses coming in. Let's go ahead and take a look and see what all of you selected. The clear favorite with 41% was HOX. In second place, we had the SHH. So let's take a look and see what the correct answer is. And the correct answer is indeed B, and 41% of you got it right. So great job, everyone. If you didn't get it right, don't worry. And even if you got it right, let's make sure you got it right for the right reasons. Boris.
Thank you, Sean. Yes, great job with this question. So this patient, we're told, has fusion of the third and fourth digits of the hands bilaterally. And this is called syndactyly, or fusion of the fingers or toes, syndactyly. Okay? And this can be caused by medications, genetics, or even both. Okay? Now, normally what happens is when we develop as an embryo, the hands kind of form as like a flat paddle-shaped plate. And then at around day 52, or a little bit after 7 weeks, the digits actually start to separate. Okay, so syndactyly is when those digits do not separate. Okay, so if we go to the next slide, we can see in a very important table in first aid that talks about some of those important genes in embryogenesis. Okay, you can see there the homeobox or HOX genes. Okay, and how they are important in segmental organization, and how if you have a mutation in that gene, it can lead to issues with appendages. Okay, so this could cause syndactyly, polydactyly if you have too many fingers. Okay, so that's why this is the best answer. Now you can see some of these other genes were actually also other answer choices. So FGF, or fibroblast growth factor, that has to do with limb lengthening. Okay, so a little bit different than syndactyly. WNT7, this has to do more so with the patterning of the limbs. Okay, so when we talk about the body developing in like a dorsal ventral manner, and how the limbs develop in correlation to that, that's more so what that gene does. And then you can see there also the SHH, or sonic hedgehog gene, and how mutations in that gene can classically lead to holoprosencephaly. Okay. So as you can see there, those are different issues than what we're dealing with. Let's take a quick look back at the other answer choices. I think there's a couple more that we haven't reviewed. And I believe that's answer choice D, or SRY. And this is found on the Y chromosome. It makes testes determining factor that allows for the development of the testes. If you had a mutation, that could potentially lead to gonadal dysgenesis, but not an issue with the hands. So the best answer here is answer choice B. So great job on this question.
Well, thank you very much, Paros. Yes, great job. Let's keep the momentum going as we tackle our second question of the evening. Once again, the answer choices have been removed. That is by design. And as always, we will begin with the lead-in. This patient's most likely condition is caused by abdominal organs passing immediately adjacent to which of the following structures? This patient's most likely condition is caused by abdominal organs passing immediately adjacent to which of the following structures? I'll give all of you a few moments to respond in the question box and let us know how many steps you believe this question will require. And then we'll go on to that vignette. All right, I see some responses coming in. Let's read that vignette. A 2-month-old boy is brought to the office because of a right-sided scrotal bulge recently noticed by his mother. She reports that it comes and goes and is more noticeable when he is crying. Physical examination shows no other abnormalities. This patient's most likely condition is caused by abdominal organs passing immediately adjacent to which of the following structures? Paros.
Thank you, Sean. So we're going to go ahead and take a look at the important clues in this vignette and the lead-in. And so we are still dealing again with the pediatric case, a 2-month-old boy. Okay. Now this is a little bit of a clinical question, and a lot of times with these clinical questions, they'll tell you, why is this patient coming to the hospital? Why are they seeing a doctor? In this case, it's because of a right-sided scrotal bulge. So you want to make note of that presenting sign and symptom. Okay. And a lot of times in these questions, they'll tell you how long has it been going on for. It's been going on for a few months, a few years, a few minutes. And that gives you a sense as to whether this is an acute issue or a chronic issue. Okay. We do know a little bit about what makes this bulge even more prominent. You could see there about what that situation is. And so you want to make note of that because that could clue you in as to what's going on with the diagnosis. Okay. And this question is asking us, this most likely condition is caused by abdominal organs passing immediately adjacent to what structure? So I think we've got at least a couple steps here. I think one, we've got to figure out what is this most likely condition. And then two, what structure is immediately passed with this condition without going too much into the condition. So I think we at least have a 2-step question, maybe a 3rd step depending on how the answer choices are worded. But you can see there this is a very interestingly worded question. So we want to make sure that we're understanding that right and we're picking up on exactly what they're asking of us. So let's take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, rectus abdominis muscle. D, psoas muscle. C, obturator foramen. B, linea alba. And A, internal oblique muscle. So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best one here. We'll talk about it in just a few seconds.
And just to clarify, the question is, this patient's most likely condition is caused by abdominal organs passing immediately adjacent to which of the following structures? The word structures didn't fit due to character limitations. I see the responses coming in. Looks like there's a clear favorite already. We'll give all of you a few moments here. All right, a couple more seconds here to get in those final answers. All right, we're getting there. Let's take a look and see what all of you selected. Looks like the favorite here with 43% was internal oblique muscle. Internal oblique muscle. In second place, we had 22% of you selecting the rectus abdominis muscle. So let's take a look and see what the correct answer is. And the correct answer is indeed a internal oblique muscle. 43% of you got it right. Great job. Let me hand it off to Paris.
Thank you, Sean. Yes, great job again with this question. So, 1, what is the most likely condition? Well, this patient likely has an indirect hernia, okay? These are typically seen in male infants, and what happens is your abdominal contents travel the length of the inguinal canal. They kind of follow the pathway of the testes, okay? And the hernia can enter into the scrotum like it did in this patient, okay? And it's worse when you strain or when you cry, kind of what we're seeing here. So let's take a look at the next slide. We'll take a little bit of a look at the anatomy of what's going on in this issue, okay? Now, indirect hernias are caused when you have a patent or open processus vaginalis. And this allows for continuity between that inguinal canal and the tunica vaginalis. Okay, so there is continuity. There is a patent, essentially tunnel there. Okay, so indirect hernias will travel adjacent to the following structures, and you can kind of see as we go through this: the transverse abdominis muscle, that's that first one; the internal oblique muscle, okay, and then the aponeurosis of the external oblique muscle, okay. This is what it will travel adjacent to during its course. And then these hernias, they actually enter in just lateral to the epigastric vessels, okay. So this question is, you can see there, of those 3 things: transverse abdominis, internal oblique, external oblique. Those are the 3 structures that indirect hernias travel adjacent to, okay? Those are all there on the left side of that image. Okay. So if we go back to our question, our other answer choices, you can see how A is the best answer here. Answer choice E is unlikely to be correct because this is located in the midline. Okay, we know we're dealing with something that's more lateral. The psoas muscle, this is more so in the lumbar region, between the vertical column and the pelvis, so not as good of an answer choice. The obturator foramen, this is a large opening in the front of the pelvis, and inguinal hernias do not pass through this. And then lastly, linea alba, this is a tendinous structure that is right in the midline. So again, probably not what we're dealing with this lateral inguinal hernia. So the best answer choice here, like you guys selected, was A.
Excellent. Well, thank you very much, Pars. Great job, everyone. Now, I mentioned RX Coach earlier. I want to tell you a little bit about it. So RX Coach is our coaching and tutoring program where we work one-on-one with students to help them accomplish their goals. If you're studying for a comp or a board exam, we'll have you take one of our assessments. And we have authored our own assessments and our own resources, unlike many other tutoring companies. We have our own question bank, we have RX bricks, we have our express videos, and our flash facts. And you'll get all those with every package. Once you take that assessment, we'll make a personalized study plan and work with you to implement that plan to make sure we can identify and bridge your knowledge gaps to make your studying as efficient as possible, but also work on your test taking skills and ensure that you know how to apply what you've been learning and studying. So if that's something that interests you, and if you want to talk about the tutoring program, you're welcome to book a free consultation to discuss our tutoring program at rx-coach.com. Once again, that's rx-coach.com. If you're studying for med school exams or in-school exams, we will look at your syllabus, your learning objectives, and make your personalized study plan that way. So once again, that's rx-coach.com. Let's move on now to our third question of the evening. This patient will most likely experience weakness in which of the following movements? This patient will most likely experience weakness in which of the following movements? I'll give all of you a few seconds to respond in the question box and let us know how many steps you believe this question will require. We'll move on to that vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 35-year-old sanitation worker comes to the clinic with severe lower back pain that began suddenly as he was lifting a heavy load. He describes the pain as sharp and radiating down his left leg and foot. He does not report bowel or urinary incontinence. The pain is reproduced when the patient's left leg is lifted at a 30-degree angle. Angle jerk reflex testing reveals 1+ on the left side and 2+ on the right side. Sensation to pinprick is diminished markedly on the lateral portion of his left foot. This patient will most likely experience weakness in which of the following movements? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so you can see a little bit of a longer vignette here. Okay, so there's going to be some important clues. And as Sean was reading that, hopefully you guys were like, wow, there are a lot of important physical exam findings here. Okay, so now we're told about a 35-year-old, and immediately we're told about his occupation. Right away, they tell us he's a sanitation worker. So automatically, when they tell you something like that right off the bat, you want to make note of that, because that could be coming into play later on. And as we see, it did. He developed, and he's coming in because of really low back pain after he was lifting a heavy load. So whenever you're given something about occupation or anything like that right off the bat, you definitely want to make note of that. Okay. They tell us more about the pain. They tell us about some pertinent negatives. You know, anytime a patient has a sharp low back pain, you always want to ask about continence. Okay. They do some physical maneuvers, some physical testing, and because of that, we're told about some abnormalities. And we want to use those. We want to make sure we're not missing those. We want to wrap those up together to see if we can come up with a good diagnosis here. Okay. So this question is now asking us that the patient may experience weakness in what movement? So I think we've got a couple steps here. I think that's an interesting question. I think one, we've got to figure out exactly what's going on in this 35-year-old. What is the issue? What is the condition or diagnosis? And then two, based off that, what additional movements would be weak for him? Okay. So I think we've got a nice two-step question here. So let's go ahead and let's take a look at those answer choices. Once again, we will start at the bottom and we will work our way up to the top. Answer choice E, toe extension. D, plantar flexion of foot. C, knee extension. B, hip flexion. And A, dorsiflexion of foot. So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Boris. Once again, the poll is open. Keep in mind that we do have a raffle and a special offer. You must be present to win the raffle, so hopefully you'll stick around. You might be our lucky winner. I see the responses coming in. We'll give all of you a few more seconds here. All right. A couple more seconds here. To get those final answers in. Next week's topic is step 2. We hope you'll join us. All right, let's take a look and see what all of you selected. 41% of you selected dorsiflexion of foot. In second place with 28%, we had plantar flexion of foot, and 24% of you selected hip flexion. So let's take a look and see what the correct answer is. And the correct answer is D, plantar flexion of foot, and 28% of you got it right. So let me hand it off to Paris so we can all become masters of this topic. Paris.
Thank you, Sean. Yeah, it's definitely a tougher question here. So what is going on in this question? Well, you know, whenever you have acute lower back pain, especially after lifting a heavy load, you want to think about a couple things. You know, a herniated disc, a lumbosacral strain, okay? Now, we do know that this patient has a positive straight leg test, which is when the leg is lifted at an angle less than 60 degrees, and you can reproduce that pain and that radiating back pain, and it radiates into the lower extremity. That's called a positive straight leg raise test, okay? And this is a little bit more specific for a herniated disc, okay? And so what happens is, one, you know, this is a little bit more specific for a herniated disc, but two, also for a disc herniation, specifically at the L4, L5, or L5S1 levels, okay? So now we can hone in on that we think this is in a herniated disc. Now let's try to figure out maybe at what level, okay? So we know that this patient has a decreased sensation on the lateral part of the left foot, okay? Also, decreased ankle reflex on this. Okay. So let's take a look at the next slide, and what we have there are our dermatomes, okay? And you can see there on that a couple of those pictures, you can see there that the lateral portion of the foot is innervated by your S1 dermatome, okay? So your S1 dermatome is innervating that lateral part of your foot. Okay. If we take a look, yep, just as Sean is highlighting. Yep. If we take a look at the next slide, there's actually a really nice table in first aid that goes over some of those high yield disc herniation levels, okay? And some of these lumbosacral radiculopathies. And you can see there at the far right, if you have a herniated disc at the level of L5S1, that is going to affect your S1 nerve root. You can have a decreased Achilles reflex. Like we know, they told us this patient had a decreased ankle jerk reflex, okay? What else can you see? Well, you can see there, weakness of plantar flexion, okay? So patients with an S1 radiculopathy can have a weakness in plantar flexion. A weakness in dorsiflexion, as you can see one column over to the left, that would be more with an L5 nerve, L5 radiculopathy. And then weakness of knee extension would be more consistent with an L4 radiculopathy. Okay, but different presentations, different areas of the skin that would be affected with decreased sensation. So hopefully you guys are seeing how it's important to know where those dermatomes are, because they could give you a question just like this. They could say the lateral part of the foot has decreased sensation, the medial part of the foot has decreased sensation, and then it would be up to you to know which nerve root is affected, okay? So if we go back to our answer choices, the few other answer choices, you know, we talked about answer choice A and we talked about answer choice C. Answer choice E would not have an issue with toe extension, okay? That is more on the medial side of the foot, as we talked about. Answer choice C, that would be more so with an L4 radiculopathy, issues with knee extension. Answer choice B, hip flexion. This would not be expected because that's, as we saw in those dermatomes, a much different level of dermatome, a little too high from what we're dealing with. And then lastly, as we talked about, dorsiflexion of the foot, that has to do more with an L5 radiculopathy. Okay, so it's important to know your dermatomes, and it's important to know what muscle groups are would also be affected, as you saw here in this pretty good question.
Excellent, Boris. Thank you very much. Let's all move on now to our final question of the evening on the topic of MSK, and let's try to finish strong. As always, we will begin with the lead-in. Which of the following structures is at increased risk of injury during this procedure? Which of the following structures is at increased risk of injury during this procedure? I'll give all of you a few seconds to respond in the question box and let us know how many steps you believe this question will require. All right, I see some responses coming in. Let's take a look at that vignette. A 40-year-old woman is brought to the emergency department because of difficulty breathing after being involved in a motor vehicle collision. She was the restrained passenger in the car. Bedside ultrasonography demonstrates a right-sided hemothorax and thoracostomy is performed. An incision is made at the 5th intercostal space on the mid-axillary line and a tube is placed just superior to the 6th rib. Which of the following structures is at increased risk of injury during this procedure? Boris.
Thank you, Sean. So let's go ahead and show you what we think are the important clues in this vignette and the lead-in. And so this is our 4th time doing this. So hopefully you guys are starting to get a sense of what are those important clues, those important physical exam findings that we need to pick up on when going through some of these MSK questions that can help you get to the right answer. Okay, and also when you're going through that lead-in, making sure you know what they're asking you. Okay, so in this question, we're told about a 40-year-old woman, and we're told she's coming to the ER because of difficulty breathing. Okay, they then tell us specifically about a procedure that's being done, and they're asking us about a structure that is at increased risk of injury during this procedure. So I think we've got first we've got to figure out I think this is a little bit kind of an anatomy question. So I think we kind of have to use our anatomy knowledge to know what structure is close to where we're doing this procedure. So this could just be a one-step question. I think knowing how that procedure is done, what things are being cut through, if anything, and then what's nearby that, and then knowing that anatomy to then answer this question. So let's go ahead and let's take a look at those answer choices. And you can see here we have 5 answer choices, and once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, intercostal vein. D, intercostal nerve. C, innermost intercostal muscles. B, diaphragm. And A, breast tissue. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. This is our last question of the evening. Hopefully we can finish strong, and then we'll move on to our raffle and special offer. All right. I see the response coming in. We'll give all of you a few more moments here. All right, let's take a look and see what all of you selected. Looks like 61% of you selected intercostal nerve. In distant second place with 13% was diaphragm. So let's take a look and see what the correct answer is. And the correct answer is actually C, innermost intercostal muscles. 10% of you got it right. So definitely a challenging question. One of our most challenging questions we've done so far in QLab. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a tougher question here. So what exactly is going on here? Well, you can see here we have a little diagram here that kind of goes over some of the muscles between your ribs. Okay. Now this patient is receiving a tube, a thoracostomy tube, okay, to drain that hemothorax. Okay. And this tube, if you can imagine, obviously it's going from the outside in. Okay. So this tube will travel through the external intercostal muscles, then the internal intercostal muscles, and then the innermost intercostal muscles. Now, these innermost intercostal muscles, these are not present over the entirety of the ribs, but they actually are limited to just the lateral ribs, okay? So they overlay that mid-axillary line where this procedure is being done, and thus is at risk of damage, okay? These muscles obviously help in respiration. So those innermost intercostals are really along the lateral aspects of the rib and the rib cage, which is where this procedure is being done in the mid-axillary line. Okay. Now, the other answer choices, the intercostal vein. These lie behind the rib, so not likely to be damaged. The intercostal nerves, these lie just under the inferior edge of this rib, okay? However, in this patient, the tube is being placed just over the superior edge of the rib, okay? So kind of avoiding that, that potential damage. So once again, the intercostal nerves lie just under the inferior edge of each rib. But as they told us in this question, the tube is being placed superior to the rib. So we're actually avoiding injury to that intercostal nerve. Answer choice B, the diaphragm. Obviously, you can imagine that is a lot lower than what we're dealing with here. And then lastly, breast tissue. This procedure is being done at the mid-axillary line. So it's unlikely that breast tissue would be at this point, and is not something that would be at a very high risk of injury during this procedure. So a tougher question here, but you can see just how important it is to know that anatomy when you're doing some of these clinical procedures. So great job on today's questions. I will hand it back to you, Sean.
Well, thank you very much, Boris. There's definitely some challenging questions tonight, and hopefully everybody learned a lot from them. If you want to continue learning from them or review them on your own, these are the 4 question IDs. You can simply log in to QMax and enter the QID number in the RX search field. It'll pull it up for you. So I'll give you a few moments here to take a picture, write them down, or make note.